Welcome back to another episode of Paramedic Zach, where I choose 10 questions from a deck of 500 flashcards that I made to help me pass my paramedic exam to share with you. In this episode, we'll be reviewing flashcards 71 through 80. And if you haven't guessed, my name is Zach, and this is Paramedic Zach. Again, welcome back or welcome for the first time, and let's jump back in with question 71. What role does glucagon play in the body? Hint: blank into blank. So glucagon is a hormone and also a medication that can stimulate the liver to convert glycogen into glucose during periods of fasting or when you administer the medication. And so the hint here for this question is going to be glycogen into glucose. Moving on to question 72. Patients in their third trimester of pregnancy should not lie on their back for risk of compressing the inferior vena cava. This condition is called blank. So if the inferior vena cava is compressed, this can result in hypotension, known as supine hypotension syndrome. Question 73. Name 3 conditions that can cause hypokalemia, i.e. low potassium. So the 3 things known to cause hypokalemia are 1. Over drinking water, 2. Potassium wasting diuretics, i.e. Lasix, or 3. DKA, also known as diabetic ketoacidosis. Moving on to question 74. You can treat hypotension following ROSC, which is return of spontaneous circulation, with these 4 things. So if your patient is hypotensive following ROSC, you should first treat that patient with a 1 to 2 liter bolus of fluids, i.e. normal saline or lactated ringers. Secondarily, you can use a pressor. A pressor is going to be either epinephrine at a dose of 2 to 10 micrograms per minute, dopamine at a dose of 5 to 20 micrograms per kilogram per minute, or norepinephrine at a dose of 0.1 to 0.5 micrograms per kilogram per minute. Moving on to question 75. A disease resulting from a decrease in dopamine production causing tremors and difficulties in muscle coordination is known as blank. So this disease is known as Parkinson's disease. Question 76. Clubbing of the fingers indicates blank. So clubbing of the fingers is going to make the patient's nail beds appear round and bulbous. This is going to indicate hypoxia or chronic hypoxia that can result from COPD or heart failure. Question 77. Hypothyroidism, also known as blank, can cause fatigue, dry skin, weight gain, a decrease in level of consciousness, and hypothermia. So the disorder that can cause these symptoms and results from a decrease in output of thyroid hormones is known as a myxedema coma. Question 78. Stroke volume times heart rate equals blank. So if you didn't know, the stroke volume of the heart is the amount of blood pumped out of the left ventricle with each heartbeat. If you multiply that by the heart rate, you're going to get something called the cardiac output, which is the amount of blood that is circulated in the body during each minute. Moving on to question 79. The J point on an ECG is defined as blank. So the J point on an ECG is going to be defined as where the QRS complex ends, in particular where the S wave ends. And lastly, we have question 80. Name the receptor. It inhibits the release of norepinephrine and insulin. It stimulates glucagon secretion and inhibits lipolysis. So this receptor is the alpha-2 receptors. Alright guys, and that is going to do it for this episode. I hope this helped you, and if it did, please give me a thumbs up. It helps a lot. And if you want to get these videos regularly to help you pass your exam, make sure you hit the subscribe button. Until next time, thank you and take care.